Emanating about telehealth. There had been a huge row about whether telehealth made sense, whether it should be paid for, a big squabble. When it became absolutely necessary to go to telehealth, period, because of COVID, a lot of the objections and concerns evaporated. The use of telehealth proved itself very quickly, and we leapt through what had been a lot of barriers. Did anything similar happen with respect to home health care as a result of COVID experience? Ms. Stein.
Yes, there was telehealth provided for people who wanted to and could access it in their home. But you know, one of the things about—
And how did that roll into the home health service side of the equation?
It helped on the, for people, for instance, who needed physical therapy and could access video and follow instructions from a therapist in that way. We had people who we knew were getting physical therapy, but if it's wound care, and if it depends on the need of the patient, and it depends on the availability of what tech they have available and how well they can use it. And home health aides provide hands-on personal care, so it's less effective with that kind of care.
One other big shift in Rhode Island was when two of our major primary care providers became ACOs, Accountable Care Organizations.
Yes.
Coastal Medical was one, Integra was another. Both of them were among the highest performing ACOs in the country. And they ramped up home health service delivery on a patient-by-patient basis because it was in their interest, once they were somewhat freed from fee-for-service, to make sure that each patient was getting the best care that they needed to keep them healthy and therefore keep costs down. And so that has worked really well. Mr. Adombi, do you see expanding? What more can we do to have that ACO example improve the experience of patients with access to home health services?
And you're so correct that the successful ACOs have relied upon home health services to their own financial business benefit in addition to the patient benefit. And the learnings from those ACOs is now being transmitted to other ACOs to manage care programs and the like, because it has been, it's been ambitious to bring home health care services to the home, but it's been an underappreciated and underutilized benefit. So a lot of the learning that you've noted that was there is now being passed on to others to see that kind of benefit. So, as I mentioned, the value-based purchasing program with home health in the Medicare program has shown that dynamic value. And so it's taking longer than we'd hoped, but it would really benefit for more to take advantage of it. I want to add to what Judy was offering on telehealth services. During the pandemic in particular, there were millions of telehealth visits done by home health agencies to patients in their homes, working in concert with physicians and nurse practitioners and the like to substitute for in-person services. And they did that in the context of a program that prohibits recognition of the cost of telehealth services as part of setting payment rates for that. So we're looking to modernize the Medicare program and recognize the telehealth.
So my time is getting a little bit short, so I'd ask to any witness who cares to respond in writing as a question for the record, any specific recommendations that you have on how we can use the ACO model and how we can use the telehealth means to expand home services. What are there things that we could do with CMS regs? Are there things we could do with CMMI models? Are there things we could do with legislation that would expand what appear to be two very productive gateways, both for lowered cost and for improved patient care and patient experience? And if I'm not mistaken, the home health value-based program, I don't know if anybody's tracking that on the, it appears to have saved a lot of money. Yeah, I'm getting some nods. So that actually creates, it's not just Rhode Island's experience that a well-run ACO can deliver home health services effectively to people and save money, or that telehealth can facilitate inexpensive home health service delivery,
You know,
but also you've got this model program that worked and that created savings.
And we worked in partnership with the Department of Health and Human Services to expand nationwide the value-based purchasing this year. Medicare projects it will save $3.5 billion over 4 years in avoidance of higher cost care, particularly in hospitals for that. So we'd be glad to work with you.
Thanks. Well, Mr. Chairman, it sounds like we know some things that work. We need to do more of them. Thank you for the hearing.
Thank you, Senator Whitehouse. Senator Young.
Dr. Grabowski, I'm going to ask you a series of questions. I ask that maybe you